Hello everyone. 21 years. 21 years is the duration of me living with a condition called as type 1 diabetes or T1D. It is pretty much a part of my identity. I am here today as a person living with type 1 diabetes, a diabetes patient advocate, to bring forward the voices of T1D patients to the forefront and ensure that they are heard. As a person living with type 1 diabetes, I take multiple daily injections, which would be around 4 to 5 times a day, and check my blood sugars on a glucometer around 7 to 8 times a day. There are multiple aspects of everyday life that affect the blood sugars of a patient of type 1 diabetes. This would include insulin intake, food intake, sleep cycle, exercise, emotions, hormonal changes, including puberty, menstruation, pregnancy, menopause, etc. It is important to know that all these aspects need to be considered and its effect on type 1 diabetes management is essential. Doctors and healthcare providers need to have a holistic approach and a view of how these aspects affect the life of T1D patients. We understand that doctors and healthcare professionals are often overburdened and would not have sufficient time to take a look at all of this. This is where we could leverage technology so that we can make the lives of patients little less stressful and help them navigate the complex pathways of type 1 diabetes management. There is a need to digitize medical data in India. Doctors need to have access to medical information of patients, and it needs to be available to them as and when required. We at Blue Circle Diabetes Foundation have taken the first step towards this with our Blue Circle Diabetes app, which is an app made by Diabetics for Diabetics. As of now, the app has multiple features wherein you can log your insulin, your blood sugars, your meals, your exercise routines, and build reports and charts on top of this and get them to your doctor so that they can understand how each of these aspects map to your blood sugars. As of now, the app has 60 million blood sugar records on the app. We want to ensure that the lives of patients living with type 1 diabetes is made much more easier and they have better quality of life as everyone else. We want to ensure that no one is left behind in this fight against diabetes. I would also like to draw your attention to the high cost of living with type 1 diabetes. In low and middle income countries like India, where the concept of universal health coverage is non-existent, all type 1 diabetes related medical expenses are paid out of pocket and borne by the patients and their caregivers. This includes insulin, medical supplies like glucometers, blood test strips, syringes, path lab tests, doctor visits, etc. We also have to take note that the prices of insulin have risen exponentially, even higher than the rate of inflation. Take note that insulin is the 6th most expensive liquid in the world. My ask here is to have the government to intervene so that they can oversee the prices of existing and new drugs in the market. There needs to be a cap on the price rise of insulin and related medical supplies. With adequate resources, correct education, and doctor support, type 1 diabetic patients can take charge of their own diabetes management and lead a life that is fruitful, meaningful, and if not as easy as everyone else. Like I said, we want to ensure that no one is left behind in this fight against diabetes. Thank you so much for having me here as a speaker today, and if you have any questions, feel free to reach out to me. Thank you.